Welcome to St Mary's Hospital in Manchester. We hope that this short video will be helpful in explaining a little bit about third and fourth degree tears and how to care for your perineum after birth.
The perineum is the area between the vagina and the back passage. This area stretches during childbirth and can tear. The majority of tears involve the skin and the underlying muscle only. In a small number of women, tears can extend deeper and involve the muscles that control the passage of wind and stool. These muscles are called the external and internal anal sphincter muscles. If tears involve these muscles, it is called a third degree tear. If the tear is deeper to these muscles and involves the back passage, it is called a fourth degree tear.
In the UK, roughly 3 in every 100 women who have a vaginal birth will experience a third or fourth degree tear. We can't predict who's going to have one of these type of tears, and so it's really important that after every vaginal birth the perineum is examined to check for a tear. If a tear is identified that involves the muscles around the back passage, then it would need to be stitched as soon as possible in the operating theatre. Mostly women will have an epidural or a spinal anaesthetic as pain relief for this, but occasionally ladies need to have a general anaesthetic. Following a third and fourth degree tear, women are given a number of medications. We use antibiotics to reduce the risk of infection. We also use laxatives to stop you straining against the stool, and pain relief. All of these medications are safe for using whilst breastfeeding.
Following any perineal tears, it's important that you keep the area nice and clean. Wash your hands before and after. We advise that you use water only. Don't use shampoos or soaps, as this can irritate the area. Pat the area dry, don't rub, as this may cause further irritation to the area as it's healing. Mobilise as much as possible, but also make time to rest. Make sure you have plenty of good support with caring for your baby.
It's really important to avoid constipation after having a tear. This can be uncomfortable and it can also prolong the healing process. So taking the laxatives that you've been prescribed, as well as keeping really well hydrated, particularly if you're breastfeeding, and keeping a healthy diet that's got plenty of fruit and vegetables in it. To help ease a bowel opening, it can be helpful to raise your knees above your hips when you're sat on the loo. A small footstool can help with that. Obviously there will be a little bit of discomfort following a perineal tear, so you can use painkillers like paracetamol or ibuprofen, and they're completely safe even if you're breastfeeding.
Pelvic floor exercises are really helpful for strengthening the healing muscles. First thing to do is tighten the muscles around the back passage as if you're trying to avoid passing wind. At the same time, try and tighten the muscles in the front passage as if you're trying to stop yourself having a wee. You should feel a lift and squeeze sensation. Hold this sensation for 10 seconds each time. Try and do this as often as you can throughout the day. Make sure that when you're lifting heavy objects, including lifting the baby, that you make sure that you tighten your pelvic floor muscles at the same time.
A really common concern that ladies have after childbirth, and particularly after having a tear, is when you can start having sex again. So it will take a number of weeks for the perineum to heal, but once it's fully healed and you're feeling comfortable, then it's fine to resume having sex.
Women who have been affected by a third or fourth degree tear are always followed up in the perineal clinic. This clinic is run in the Worrell unit on the ground floor in St Mary's Hospital. The appointment will come to you in the post, as will a symptom questionnaire. This is really useful to see how your recovery has gone, and it is really important that you fill it out and bring it with you to the clinic. During your appointment, we'll be able to talk about how your bowels have been working and just generally how you've recovered since your tear repair. We'll also perform an examination to see how the muscles are healing. Most women heal really well, with 80% of women who've had one of these tears being symptom-free 12 months after their repair. If there are any concerns or problems, we can do further investigations to see how the muscle works and to look at the muscle and how it's healed. This will help us to guide further management for you. We will also be able to discuss with you any future plans for delivery, and you'll have plenty of time to ask as many questions to the medical team as you need.